Hi, Miss.
Hi, Belen. Good afternoon. How is everything?
Good afternoon. Everything is fine. And you, Miss?
Pretty fine, thank you. Okay, we're gonna wait a few minutes and then we're gonna start, okay?
Okay.
I wanna know, Belen, are you looking for some test or I don't know, or scholarship now for your
Well,
specialty?
it's really hard to say that because scholarships it's really difficult in medicine. So I know that I have to take exam like to every country I wish to go. So
Yeah.
that's the thing.
Yeah, that's pretty hard in medicine and in odontology too. I think it's worse, even worse. I never find any scholarship for that besides public health, just that. But on the other areas, it's so difficult. That's right.
Yes.
So, but what do you think? What would you do? Or you're just looking for something in Cochabamba?
No, 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 Cochabamba. No, I want to go outside. And
Okay.
that's my plan. I don't know if USA or maybe Europe or Chile.
Okay. Hi, Ale. Good afternoon.
Hi, Miss. Good afternoon. Hi, Belen.
Hi, Ali.
Okay, I understand. Okay, I think oh, Lily is gonna get in later. I don't know, Vanya, but we can start, okay? Otherwise, we're not gonna have enough time. Okay, today we're gonna talk about taking a history or maybe feeling the medical history. And we have to take in consideration for a full case history covers that it must have personal details, presenting complaint, past medical history or PMH, sorry, drug history, family history, social and personal history, patient ideas, concerns, and expectations, review of systems. I don't know if you want to add something here, something you were working with uh, on your internship, right?
Presenting complaint is like an amnesis, Miss.
No, presenting complaint is like when, for example, I'm the patient, I'm gonna be the patient, and I go to the doctor and I say I have a headache, I don't know, I cannot sleep, I have a stomach ache, I'm so bad, I don't know what happened to me. That's why I come to you. That's a her complaint in this case, and the patient is presenting the complaint for what the reason why she is going to the doctor. Do you understand?
Yes, Miss.
Yes,
Thank you.
Miss.
Okay. Do you understand in Spanish the word complaint?
Actually, I know that complaint it's like quejarse, right?
Right, right, that's right. Oh, but in this context, it's not gonna be like a queja, right? It's gonna be the reason why the patient is going to the doctor. Okay?
It would be motivo de consulta.
Yeah, could be too. Okay. Do you have any other questions here? Or do you want to add something else? As I said. I'm gonna go out. Okay, I'm back. Maybe, I don't know if you use this, but in odontology, we use a history, a medical history that it comes from the Ministry of Health, okay? And we have some specifications like an odontogramma, for example, or an odontogram, where we can find every single teeth and we can write if there is a cavity or not, if they have a tooth or not, and those kind of things. The one you usually use has this list, or we are missing something here?
Well, I don't know if Ale saw that, but I didn't see. When we write the history, we have to do it by our words. And yes, in the review of systems, we have to be really specific, like we are separating things, like first in head, then eyes, ears, and that thing, but with our words. I don't know if I'm correct. Maybe Ale has another experience, so knows anything more.
Okay, thank you, Belen. Ale, what about you?
I think in presenting complaint, we use our words, but we use, I don't know, technical expressions in the rest of the history.
Yeah, that's a good thing. It happens the same in odontology, for example. First, the patient says, I feel pain here or there, or maybe, and you have to write down with technical words, right? But Belen was saying that on the part of review of systems, she did it by parts. You have the same experience?
Yes, I'm agree with Belen.
Okay. Perfect. Like in semiology, right? Maybe that's the name?
Yes, Miss, it's correct.
Okay. So we are in the same page. That's good. Then we have, well, first of all, personal details. Belen, can you read this part, please?
Okay. Normally, patients' personal details have been entered in the records by a nurse or administrative staff before a doctor sees. However, on later consultations, a doctor may wish to check details such as address, date of birth, occupation, or marital status. To find out or to check a patient's occupation, doctor asks, "Do you work? What do you do for a living?" Patients may respond, "No, I'm unemployed. I'm out of work. No, I'm retired. I'm a pensioner. Yes, pensioner. Yes, I work for a bank. I work in a factory."
Okay, thank you very much. And that's more or less what we ask when we are interested on personal details. I don't know, if you want to add something here, something that you can usually ask to your patients on the personal details.
We also ask about his religion.
Oh, right. I didn't do, I think I never heard about that, but yeah, it must be done, right? Because we don't know, maybe they are testigos de Jehová or something like that, and they do not require treatments, specifically treatments, right? I don't know if you have that experience with that kind of religion.
Not yet, Miss.
Okay, but you have to take care with that. You have to ask, and that's a good thing to ask about religion, because with that kind of people, maybe we can be more invasive or something, and they can get mad at that. Okay. Vania is here. Oh, Lily. Hi,
Hi,
Lily.
here. Good afternoon, teacher.
Good afternoon. Lily, we are talking about medical history, and we're here in personal details. I don't know if you ask something on your consultation, something specifically on personal details that is important for you.
For me, the details are very important because I need to know my patients, where your pets, allergies, if take a drugs, eh, entre otros. I don't know.
Okay, but here in on personal details, maybe, I don't know, Belen told me that she asked for their religion. I don't know if you ask something else. Or do you think we can ask just about the record? I'm sorry, I just about their address, date of birth, occupation, marital status, and just that.
In general, the dates it's take for the the other peoples. For example, in reception.
Huh? Okay. Okay, maybe the nurse will take for you these details, right? These questions. Maybe in the case of the girls, Belen and Ale, you did it on your own at first, or you have some people to help you. Maybe an assistant or something.
No, we did it by ourselves. We have also the theory in the classes, but when we go to the hospital, we have to do it by ourselves.
Okay, yeah, it happens the same for me. I don't have an assistant sometimes, and I have to do it myself. Okay, but in some other cases, and in the future, I think you're gonna have help. That's why I wanna know what kind of questions are important for you. I'm curious about that, okay? Okay, Ale, can you read this part, please?
Yes, miss. To find out or to check a patient's marital status, doctors ask, do you have a partner? Mm, Patients may respond, no, I'm single, separated, divorced. Yes, I'm married. I live with my partner, spouse, husband, wife. No, I'm a widow, widower, divorced. My spouse passed away last year. Not. A spouse can be a wife or husband. A widow is a woman whose husband is no longer living. A widower is a man whose wife is no longer living. To avoid saying someone is dead, patients may say that person has passed away.
Okay, thank you, Ale. Just a few things. This word, divorced, okay? Then we have living, divorced again, widow and widower. This we use for woman and this for men. Okay, a man who lost his wife is a widower. Do you have any questions here for vocabulary maybe?
No, miss.
No, miss.
No, teacher.
Thank you. Okay, talking about pain. Lily, can you read this part, please?
Talking about pain. Case notes are key for each consultation. The presenting complaint section of case notes records the patient's symptoms. For example, a headache type, R-side, temporal headache, severe, troubling, last 24 48 hours. In this case, the patient complains of the headache. For a list of questions, the doctor asked this patient, and for patient descriptions of other kinds of pain.
Okay, thank you. And we have headache types, right? Can be for tension, these two for tension, these can be taken as a migraine, and these, I cannot read it. Can you read it, girls? Oh,
Clustered, I don't know what pronunciation.
cluster, I think. Okay, do you have any kind of name or definition for this kind of pain here, right here?
Yes, miss.
How do you call it?
For what type?
This one, the last one, the one we cannot read.
Oh my God, that one. I really don't know that one.
It can
But
be like neuralgia, neuralgy, or not.
I don't know for the place. Maybe.
Okay. Neuralgia is the name in English, okay? Well, in that case, maybe you can have a note, right-sided temporal headache that is severe and throbbing from lasts 24 to 48 hours, okay? And in this case, the patient complains of a headache for at least of the questions the doctor. ask his patient and for patient's description of other kinds of pain. Maybe you have specific questions to notice what kind or type of headache the patient is suffering, right? I don't know if you can make a comparison. In which cases do you think the patient feels pain in some places or in other? Do you have any example, maybe? For example, how can you make a difference between migraine from I don't know what is the name, sinusitis?
Sinusitis, we can say that the pain is like in their cheekbones, like it's in the image. And the migraine, well, the type of pain it's like unilateral in so many cases. And I don't know, we have a lot of other symptoms, like we have nausea, we have a change on the visual camp. We also can have vomits and that things.
Okay, thank you, Belen. And that's interesting because just by asking specific questions, you will get to a differential diagnosis, right? And you will say, what is your patient suffering of? So is there any kind of experience maybe that you have in your mind and say, yeah, sometimes they come and they say, for example, I have a pain just in this tooth, right? In my case. And it results that his tooth is okay. It has nothing. But I will ask some other questions to this patient. And he told me that he was just brushing his teeth and accidentally he just punched with the brush on the gum, right? Then I know that he is feeling pain just because of that. I don't know if you have any little experience like that. Lily, maybe in your case? In emergencies, people come maybe for something that maybe is not what they think or not.
Yes, teacher. We tend to confuse the different symptoms. Whether are to have many factors, for example, the age, the paths. Specifically, I don't know say it.
Okay, don't worry. That was in general. I thought you have a specific situation. For example, what I said, but it's okay. I know that patients come sometimes with that kind of things. Okay, then we have drug history. Here is an extract from a medical textbook. It is essential to obtain full details of all the drugs and medications taken by the patient. Not infrequently, patients forget to mention or forget the name of drugs they take. Some may be over-the-counter remedies unknown to the general practitioner. The insignificance of others, such as herbal remedies or laxatives, may not be appreciated by the patient. It is necessary to determine the precise identity of the drug, the dose used, the frequency of administration, and the patient's compliance or lack of it. It is important to ask about known drug allergies or suspect drug reactions, and to record the information on the front of the notes to be obvious to any doctor seeing the patient. Failure to ask the question or to record the answer properly may be lethal. And that's so true. That is exactly what Lily was saying, right? She talked about allergies, maybe. Did you have any experience with that, Lily?
Mm. I I have different experience with respect the allergies. For example, we don't have to pass the infants or the babe or the drug. For example, I applied dipirona for lower the fever to 30-year-old boy. Then the patient present dyspnea, edema of the lips, rash in the skin. Then I applied adrenaline for control the symptoms.
Yeah, that's right. Adrenaline, right? Yeah. What about you, Belen or Ale? Did you have any experience with that? With allergies?
No, I don't have any experiences, but I know that we have to ask the patient, that it's really important.
Okay. And you, Ale?
No, miss, I didn't have any experience.
Okay. Do you have any questions about vocabulary?
No, teacher.
No, miss.
Okay. Ale, can you read this part, please?
Yes, miss. To find out about drug history, doctors ask details of drugs and medications. Are you taking any medication at the moment? Do you use any over-counter remedies or herbal or homeopathic medicines? Which tablets do you take? Frequency of administration. How many times a day? compliance. Do you always remember to take it? Side effects and allergies. Do you get any side effects? Do you know if you are allergic to any drug? If the answer is yes, what symptoms do you get after taking it?
Okay. Do you have any questions here for vocabulary?
No, Miss.
Do you understand this word compliance?
I think that it's like, I don't know how to say it in English, but it's when the patient has to take the pills when it has the hour, like it's the time to take the pill. I don't know how to say it, explain.
Yeah. In Spanish, you can say it now.
Es como cumplimiento, right? Es como
Yeah.
something.
Yeah, that's the translation, but it has to, it's related with the time the patient or the accomplishment with the patient with the drugs, right? They have to take at the right time in the right doses. Okay. Don't you have any questions?
No, teacher.
Ale, what about you?
No, miss.
Okay. Then we have family history. Belen, can you read it again, please?
Okay. Note, the age, health, or cause of death of parents, siblings, brothers and sisters, spouse, husband or wife, and children. To find out about family history, doctors ask, do you have any brothers and sisters? Do you have any children? Are all your close relatives alive? Are your parents alive and well? Is anyone taking regular medication? How old was he when he died? Do you know the cause of death? What did he die of? Does anyone in your family have a serious illness?
Okay, thank you, Belen. And that's right. We usually use these kind of questions to know about the family history, right? I don't know if you can add something here to this list from your experience.
We ask about the age of their family.
Okay. Okay, perfect. What else? Or it's pretty much complete besides that question?
It's complete.
Okay. What about you, Lily or Ale? Don't you want to add something?
It's complete, teacher.
Perfect. Well, here in notes, we have, I know you understand most of the words, but we have maybe this one, siblings. That means talking about brothers and sisters, okay? Like when we say parents, we talk about mother and father, okay? And I don't know if you have any other question here.
No, miss.
Okay. Lily, Belen?
No, teacher.
No, miss.
Perfect. Okay, social and personal history. Lily, can you read this part, please?
Record the relevant information about occupation, housing, and personal habits, including recreation, physical exercise, alcohol, and tobacco, and indicates all children about school and family relationships, typical question, and taking a social and personal history art. What kind of house do you live in? Do you live alone? Who shares your home with you? How old are your children? Are any of them a nursery or school? What's your occupation? Do you have any problems at work? Do you have any financial problems? Do you have any hobbies or interests? What about exercise? Do you smoke? Do many a day? How many a day? Have you tried giving up? What about alcohol, wine, beer, or spirits? Can you give up alcohol when you want? How much do you drink in a week? What's the most you would drink in a week? Are you aware of any difference in your alcohol consumption over the past 5 years?
Okay. Okay, thank you, Lily. I don't know if you have any questions here. And if you want to add some specific question that you usually use in your consultation. For example, in my case, in dentistry, when we are on rural areas, it's common to ask about chewing coca. Okay, if the patient, how many times you chew coca, or if he or she usually chew that thing, because it's so relevant for our diagnostic. Okay, I don't know if you have another question specifically, or maybe from vocabulary.
We also ask about if they have the primary services like water, light, and that things that it's really important.
Yeah, that's true. It's really important. Okay, good. I don't know if we are missing something else. Lily or Ali, you want to add something?
No, teacher.
Okay.
No, miss.
Okay, because I think it's pretty much complete, right? Then you don't have any questions.
No, miss.
No, miss.
Okay, continue. Reviewing the systems. Once you know the main reason why the patient wants medical attention, it is sensible to ask about the systems to determine the patient's general state of health and to check for any additional problems. The patient should be encouraged to describe symptoms spontaneously, initial questions if needed, but avoid putting words in patient's mouth. Open-ended questions. For example, what's your appetite like? Or how's your vision? And closed questions. Have you eaten today? Is your vision ever blurry? Do you have any other examples here? For example, maybe in children, you cannot ask some questions like, Do you usually eat candies or something like that that is guide, right? Because the patient, the child will tell you, yes. And maybe just following your like a game, right? That's why you always have to ask their tutors or parents. Am I right? Maybe if you work with children, you have any experience with that?
No, Miss, I don't have experience because when I saw children, the doctor didn't ask about that things.
Okay. What about in a case, like for example, someone with bulimia? Would you ask open-ended questions or closed questions? Because we know this kind of people will lie, right? How do you find out?
I think we can use both questions. Like first, we can start with an open question and then being more close and close.
Okay, trying to get confident with her or him, right?
Right.
Okay. Do you have any questions for vocabulary?
No, Miss.
Lily and Ale?
No, Miss.
Now, teacher.
Okay. Ale, can you read this part, please?
Yes. Ask about the central nervous system. Do you suffer from headaches? Have you ever had a blackout? What about fits? Have you had any dizziness? Do you get singing in the ears? Have you ever experienced any numbness or tingling in your hands or feet? Do you have any problems sleeping?
Okay, thank you. Thank you, Ale. What kind of questions, maybe that is not in this list, you can ask? You can also ask. Do you usually use this kind of questions on your consultations?
Yes, Miss.
Okay.
Yes, teacher.
And it's complete, or do you think it missed something?
To ask in general, I think that it's complete.
Okay. What about you, Lily?
I think the questions are very complete.
Okay, and Ale?
Yes, Miss, I agree with my partners.
Okay. What about, I don't know if fits here. asking the patient, maybe, do you know the date or the year? In which year are we? Or these kind of questions?
Yes, Miss, we asked that things.
Okay. I thought I was wrong. But yeah, maybe talking about blackouts or headaches, maybe people just are not so lucid, right, at that moment. So those are good questions to ask. Okay. Okay, Belen, can you read this part, please?
Okay. Patient ideas, concerns, and expectations. It's important during the consultation to give patients the chance to express their own ideas and concerns about their problem and to determine what their expectations are. The letters I's or ideas, concerns, and expectations are a way of remembering this. Ideas. What do you know about the problem, condition, illness? Do you have any ideas about this? How do you think you got this problem, I think. What do you mean by concerns? What are your worries about this? Do you have any concerns? How might this affect the rest of your family? Expectations. What do you think will happen? What do you expect from me? What were you hoping we could do for you?
Okay, Belen, thank you very much. Yeah, here it was problem. Okay, so I don't know if you use this kind of maybe questions to talk about the illness or the disease with your patients, or maybe it's not necessary, not that necessary.
The questions are very important.
Okay. For example, in which cases or in every single case you work with these questions, Lily?
Because we know that the patient, the opinion about the illness or condition, besides that he can't expect for us.
Okay. So it's important to have a little bit confident, or to be a little bit confident with your patient, right? Just to know what is he or she thinking about the illness he or she is suffering. Maybe will help to follow a correct guidelines to follow the treatment too, right? I don't know, what do you think, Belen?
I think that, well, it's really important to, like it says, that the patient explains what they're feeling, because I have an experience about that, and a woman came to the consult saying that she has extra systoles. But my doctor, I don't know if he was in a bad humor or I don't know, but he didn't believe her, and she starts screaming, and And from the two sides of the part, I know that the patient was really scared, and she was trying to explain that she felt really bad. So I understand that too, but my doctor was really hard with her, and I don't know, after that, the woman got retired from the hospital. So I don't know. I think that we have to be very empathic with the patients, because they're coming for us because they don't feel good. So it's important that we also take our humanity out and treat our patients with love.
Okay, Belen, thank you. Yeah, that's right. I think people come to us as a personal of health because they think we can help with their problems, right? Especially with their physical problems. Besides, they want to tell us maybe their complete history or something. In that cases, we have to find a way to tell them that you're not the correct person to talk about that. You can guide them to an specialist, right? Like a psychologist or psychiatric or something like that, but not act like that with a bad behavior. Okay, Ale, what do you think about this?
I'm agree with Belen. We have to be kind with the patients because they are suffering because their illness, and they would feel very bad if we treat, I don't know, rude with them.
Okay, if we act rude with them. Okay, thank you, Ale. Okay, we have phrasal verbs in history taken, and phrasal verbs are often used in formal spoken English. It's more advanced, okay? Both patients and doctors may use them in consultations. A phrasal verb may have several meanings according to context. We have a few ones here. Bring on, for example, is there anything special that brings on the pain? And the meaning, cause or induce. Bring up, when you cough, do you bring up any phlegm? Meaning expectorate or vomit. We have carry on taking the painkillers for another week. The meaning, continue. Come on. When does the pain come on? Meaning, commence. Give up. My advice is to give up smoking. Meaning, to stop. Put on. I put on a lot of weight in the last months or so. Meaning, gain weight. Turn out. She had all the tests and it turned out to be cancer. Meaning, happen in the end. And turn up, the rash just turned up out of nowhere, meaning appear unexpectedly. Okay, so we have here some examples to use when we are asking some questions to our patients. Do you have any questions, or is everything clear?
It's fine, Miss.
It's fine, Miss.
It's clear, teacher.
Perfect, guys. Okay, so I don't know if you have any question till here. It was pretty much clear, right?
Yes, Miss.
Okay. Well, I'm sending to you my questionnaire. I will ask please to fill it for me. I want to ask you if you have decided the time for Tuesday. Someone is missed. Okay.
I can be first, Miss.
Okay, Belen, you're gonna be first. Who's gonna be second?
I'll be the second, Miss.
Okay, Ale, the second one. And Lily, it's okay to be the third one or you wanna be the last?
It's good the third, teacher.
Perfect. Okay, guys. Thank you very much and see you on Tuesday, okay? Have a great weekend. Take care. Bye-bye.
Bye, Miss. Bye, girls.
Bye.
Bye-bye. I'm gonna left for you as 2 practices, okay? They are not too long, but I want you to practice a few things with me.